Welcome to the Attention Deficit Disorder Expert Podcast Series by Attitude Magazine.
I'm Susan Kaufman, and you're listening to Attitude Magazine's ADHD Experts Audio. Our guest today is Dr. Daniel G. Amen, a physician, double board-certified psychiatrist, teacher, 8-time New York Times bestseller author. Dr. Amen is the founder of 6 clinics around the country. He has a great website, amenclinics.com, that has tons of helpful information about brain disorders. So with that, let me turn it over to Dr. Amen with our thanks.
Well, it's such a joy to be back. I think this is my 3rd or 4th webinar with my friends from Attitude. And it's a topic that's near and dear to my heart, which is how do we optimize ADD. And my book, Healing ADD, has been very important to us because I have it in my family. And it's been one of the primary issues that our clinics have dealt with over the last 25 years. And I'm a child psychiatrist by training, and half the kids we see have ADD. And one of the things I learned early on is you really cannot effectively treat children who have it unless you diagnose and treat the parents they got it from. ADD is a genetic disorder, as we will soon find out. So I like to start with people who have ADD have many strengths. They're often very bright, creative, spontaneous, successful. It's been thought Edison had ADD, as well as Michael Phelps, the most decorated athlete in Olympic history. Also, Justin Timberlake and Terry Bradshaw have come out and said that they have ADD. They're often people who think outside of the box, and it's well known in the business community that many CEOs have ADD. But there are also significant challenges when it is left untreated. There's a higher incidence of school failure, drug and alcohol abuse, obesity because of the impulse control problems that can go along with it, depression, job failure, divorce, incarceration, even Alzheimer's disease. A new study out last year said that having ADD actually triples the risk of Alzheimer's disease because it increases many of the risk factors associated with Alzheimer's, such as not finishing high school, drug or alcohol abuse, obesity, depression. Those things all increase the risk of Alzheimer's disease. There's a high incidence among firefighters. You have to ask yourself who runs toward fires as opposed to people like me who run away from fires. There are a number of myths about ADD. I think it's important to understand. People think it's a fad, even though I've heard that every single year since 1979 when I first learned about ADD. It's been described in the medical literature for over 100 years. A lot of people say it is overdiagnosed, which may be true, but it's also significantly underdiagnosed, especially in girls, because they don't bring negative attention to themselves, and in non-hyperactive introverted males. It is increasing in our population. There's just no doubt about it. Where classrooms used to have 1 or 2 of these kids, now they have 4, 5, 6, 7, 8 in their classrooms. And I think the reason is we are limiting PE, which also means you're limiting sunshine in kids. There's the excessive use of video games. Just last hour was talking to a mother whose son clearly has ADD and has a video game addiction. There's also, we're being exposed to toxins in much higher rates. Of brand new studies out just this year showing pesticide load in our bodies is clearly associated with ADD. Pollution, air pollution load in our body is also associated with ADD, so we're being exposed to toxins, processed foods. Early 1980s, fat is bad, cholesterol is bad. They unfortunately replaced fat in our diet with sugar and processed foods. My mind clearly associated with ADD. Clearly runs in families. This is my daughter, who is the hyperactive one growing up, and now she has Liam, who's very much like her. So clearly, our experience, a lot of other people's experience as well, is if you have an ADD child, odds are one of the parents has it. If you have both parents have it, because often people with ADD tend to find each other, then almost all the kids will have it. So there are genetic causes to ADD, but also if you have brain trauma to the front part of your brain, that'll make you look like you have ADD symptoms. So it's one of the huge lessons we've learned at Amen Clinics. Food allergies can make you look like you have ADD, so I think all people who have ADD should go on an elimination diet for at least a month and be really serious about it for at least a month. Lead exposure has been associated with it, as has oxygen deprivation, and infections like Lyme and Panda syndromes or strep infections have been associated with ADD and OCD-like symptoms. Another myth is people with ADD should just try harder. Try harder. If only you tried harder, you would do better. Our brain imaging work, which is probably what we're best known for here at Amen Clinics, over the last 24 years, my colleagues and I have literally built the world's largest database of brain scans related to behavior. We've now have a database of 111,000 scans on patients from 111 countries. So this is not based on 50 cases that we've seen. It's based on a lot of data. And what we found in our ADD brains is the harder they try, the worse it gets. So often their brains are fine at rest, but when we get them to do a concentration task, their brains decrease in activity. That's what you can see by the holes. So what you're looking at are two SPECT scans. SPECT looks at blood flow and activity. It looks at how your brain works. And you're looking at the underside of the brain. So what you should see is full, even, symmetrical activity. The color doesn't mean anything. It's the shape that matters. And the holes indicate areas of significantly low blood flow. And you can see when this person tries to concentrate, their frontal lobe shut down. The harder he tries, the worse things get in his brain, which means as he's trying, it becomes harder to think, harder to make a good decision, harder to be focused. On treatment, this brain is so much better. That's what we get really excited about. You are not stuck with the brain you have. You can make it better. We can prove it. Another myth is everybody outgrows it by 12 or 13, but clearly half the children who have it will have symptoms into adulthood. They tend to outgrow the hyperactivity, but still have the restlessness, impulse control, and distractibility issues. So I think of the hallmark symptoms of ADD are short attention span, but not for everything. For regular, routine, everyday things, easily distracted, problems with organization, especially for time and space. So they tend to be late. Their space tends to be not very well organized, poor follow through, and issues with impulse control. So they often don't think before they say things, think before they do things. We all have times when we have a short attention span or we're disorganized. Is this the pattern of your life? So my task today is really to give you other interventions besides medicine. And I want to talk about my idea on, so what are the steps? If you have ADD, how would you heal it? Know your type. I mean, I think that's the big innovation that I have contributed to this field. It's just not one thing. It's 7 different things. Stop thinking everybody's the same. Targeted supplements or medications to your type. Got to get your diet right. I just think it's a huge intervention. Your brain uses 25% of the calories you consume, so a fast food diet is going to equate to a fast food mind. For the right behavioral strategies, along with getting your family involved. So when I first started doing the imaging work in 1991, as a child psychiatrist, half my patients had ADD of one form or another, which means I also saw a lot of their adults. And when we started scanning people, we very quickly realized it wasn't one thing. Initially, it was 5 things, then 6 things, then 7 things that I write about in my book, Healing ADD. If people really like this lecture, they can also go to, I have a free video series called healingaddcourse.com. You can go check that out. So here are the types. Let me just quickly go through them. So the first one is classic ADD, usually due to low dopamine levels, short attention span, distractibility, disorganization, procrastination, poor impulse control, plus they're restless and hyperactive. So pretty much what people classically think of is ADD or ADHD. Here's an example of a patient that when she concentrates, her brain drops in activity. And how we treat this type is we boost dopamine. Now, you can do that with exercise. You can do it with a higher protein diet. You can do it with stimulating supplements like green tea, L-tyrosine, rhodiola, ginseng, or medication stimulants that we usually think of for ADD, Ritalin, Adderall, Vyvanse, Focalin, Concerta. Intense exercise can be really helpful. It's helpful for all the types. A specific diet, which is basically a low carbohydrate, high protein, high fat diet. Omega-3 fatty acids, especially those that have a higher EPA content than DHA. They're different kinds of omega-3 fatty acids. Inattentive ADD, they have the trouble focusing, but they're not hyperactive and not very impulsive at all. They tend to be more introverted. It's more common in girls. They have fewer behavior problems, but they still have the low activity in their prefrontal cortex. This is actually another daughter of mine, Brianne. She has this type and always a sweet kid, but never did well in school until she was properly treated. Her brain was really low in activity and much better when I put her on a stimulant. And how we treat this type, again, we boost dopamine, higher protein diet, stimulating supplements or medications. Exercise helps this type as well. And then one of the most interesting types is what we call overfocused ADD. The problem wasn't so much low activity in the prefrontal cortex, it was high activity in a part of their brain called the anterior cingulate gyrus. It's the part of your brain that helps you shift attention. And so in order to pay attention, not only do you have to sustain your attention, you also have to be able to shift it, to go from idea to idea or thought to thought. Well, these people can't do that because the front part of their brain works too hard, and they end up getting stuck in loops. They tend to have low serotonin and dopamine levels. So too much activity in this part of the brain. And so overfocused ADD, the symptoms are really they get stuck. So they have all the ADD symptoms, so short attention span, distractibility, procrastination. But their procrastination is not that they can't do it, it's they obsess on it. So they tend to worry, hold grudges. If things don't go their way, they get upset. They tend to be argumentative and oppositional. They're arguing with you in your head as soon as you say something. And they see too many errors, which is really interesting. And they also come from families of people who get stuck. So doing a good family history will often tell you a lot of information about them. So how we treat this type is we raise both serotonin and dopamine. You can do it with supplements or medications. So the supplements to raise serotonin, 5-HTP, L-tryptophan, saffron, inositol. And so what I'll often do is use 5-HTP with green tea as a way to be helpful. for this type. From a medicine standpoint, I actually wrote a book about this 20 years ago called Healing the Chaos Within, which was about children and grandchildren of alcoholics. And on a combination of Prozac and Ritalin, they would just do amazingly well. Over the years, our practice at Amen Clinics has morphed to include supplements, but I think we're still masterful at using medications. But for this type, boosting serotonin and dopamine, and do not put them on a high-protein diet because, in fact, that will make them mean. So they need more sweet potatoes, more hummus in their diet than type 1 or 2. My wife actually has a cookbook on CD-ROM called Healing ADD Through Food that I just I'm so proud of her because she is masterful at taking really healthy food and making it taste amazing and putting it into these types. Temporal lobe ADD is, I suppose as a psychiatrist, I see more complicated. I know I see more complicated patients than most people, especially if they come to Amen Clinics because we do the imaging work. And early on, we learned if your temporal lobes aren't right, you're not going to be right. So the temporal lobes are underneath your temples. They're behind your eyes. They're involved in very important activities like learning, memory. And so if you have ADD symptoms plus temporal lobe symptoms, mood instability, irritability, temper problems, that's what we call temporal lobe ADD. So they have the ADD symptoms plus, often with dyslexia or learning problems, often have trouble holding information and maybe irritable. Here's an example of a patient of mine who had ADD, but Ritalin made him hallucinate. He also had violent outbursts, and I met him during his third psychiatric hospitalization. He had really low temporal lobe activity, really low frontal lobe activity. And how we treat this type is we use supplements or medicines to boost GABA. So it could be GABA as a supplement or an anti-seizure medicine like gabapentin or Neurontin. And then we would use a stimulant. So you have to get the order right for this type in particular, in that order. So supplements or medications to boost GABA, then supplements or medications to boost dopamine. They do better on a higher protein, lower carbohydrate diet as well. Limbic ADD is where we really see ADD with significant negativity, sadness. So it's like they have both depression and ADD. Glass half empty attitude, often a poor appetite, more socially isolated. And this is the type I like stimulating supplements or medications that also enhance mood. So here, from a supplement standpoint, I would use SAMe. From a medication standpoint, I'd use Wellbutrin. And I found it to be really helpful for this particular type. One of the later types I described was the Ring of Fire, where it wasn't low activity in the brain, it was high activity in a pattern that looked like a fire. There was all the ADD symptoms, moody, easily distracted, too many thoughts, overly sensitive to light, sound, and touch. Jarrett's an example, who had the Ring of Fire. He's just done dramatically well. We think it may be early bipolar disorder, or they have significant food allergies, inflammation, sometimes even infections like Lyme can cause it. So we'll put them on an elimination diet and then strategies to calm their brains. We may use GABA and serotonin together. And then the last type I described, anxious ADD. So they have all the ADD symptoms, plus they tend to be anxious, nervous, tense, predict the worst. And we use deep relaxation techniques. Meditation can be really helpful. We'll boost GABA and dopamine. So I know this is a lot of information quickly, but I talk about it either at healingaddcourse.com or my book, Healing ADD. Stimulants alone usually make anxious ADD people more anxious. So one of the things I was really tasked with today is to give you, what works in treating ADD. Let's start with what makes it worse. If you really are an evil person and you wanted to make ADD worse, say you're the ruler of the empire, and you would let everybody watch as much TV as they wanted and play as many video games as they wanted. Research is clear, I think, that it makes ADD worse. You give them a sedentary lifestyle. You'd feed them the standard American diet filled with processed, pesticide-laden foods with a lot of sugar and foods that quickly turn to sugar. You would sleep deprive them. Sleep is so interesting. We could do a whole session on sleep. And you'd give them caffeine, nicotine, and energy drinks. Yes, they do help ADD short term, but long term they make things worse. And so, I think about healing ADD. I limit TV and video games. I remember when Atari came into my life. I think it was 1987, and my son was 11, and his grades just completely went down as he started video games. So I took the video game stuff out of the house, and then he did better. You want to walk. Exercise is, in both research and my clinical experience, one of the most important things you can do to help with ADD. So limit TV and video games, consistent exercise, especially coordination exercise, dance, table tennis can be really helpful. Not any sports that'll put you at risk for a brain injury, because that'll make your ADD worse over time. Focus on sleep. So I'm reading this great book called On Command, and there's a whole section on sleep and how critical it is for soldiers. If soldiers get 7 hours of sleep at night, they were 98% accurate. If they got only 6 hours of sleep, they were 50% accurate. Notice that huge difference with only 1 hour difference of sleep. If they got 5 hours of sleep, they were 28% accurate. If they got 4 hours of sleep, they were only 15% accurate. They were dangerous. So really focused on teaching the kids why, and yourself, why sleep is important, and really developing great sleep hygiene habits, which means no gadgets on at night, the room very dark, like pitch black dark, a little cooler than normal, and no noise. A lot of people who have ADD have trouble sleeping, but they do better with an eye mask, earplugs, and perhaps white noise, like a fan. You want to eliminate caffeine, nicotine, and alcohol. Alcohol clearly make you ADD, as will marijuana. I don't know how many times I've had this discussion over the last 30 years. Kids will come in and go, but marijuana helps me concentrate. Well, maybe if they have the ring of fire, it's calming things down, but it's toxic. We have to sort of, look at the truth, and the truth is we should not be putting people in jail who are smoking pot. That's just a stupid idea. It's a stupid idea. We could go on and on about that. But it is not good medicine. Like caffeine, nicotine, and alcohol are not good for your brain. Neither is pot. Diet, which is absolutely critical. We'll talk about that in a minute. And then type-specific supplements or medications like we talked about. There are a number of studies on using elimination diets for children. And in one study, Pessler from Holland found that after 6 months on an elimination diet, 70% of the children responded. It's just an amazingly high response rate. So what does that mean? It basically means you eliminate anything that's potentially toxic for the kids. And the reason it's hard to do elimination diets for ADD kids is often mom or dad has ADD, and it's just hard for them to organize themselves. in Healing ADD Through Food, Tana's book, she really tries to make it as easy as possible with, recipes that have 5 ingredients or less. But I find that's just critically important. So here's some of the rules. Protein for breakfast. Keith Connors from Duke actually said if kids eat protein in the morning, their medicine lasts longer throughout the day. Blood sugar stabilization is absolutely essential for kids who have ADD. And so bacon and eggs is better for you than having a sugar cereal breakfast or muffins, donuts, Pop-Tarts, waffles, pancakes. So you need to eliminate those things and think of more protein in the morning to help, and fat to stabilize blood sugar. So protein shake, a hard-boiled egg, bacon and eggs, and this is going to sound odd to people, but I'm a huge fan of fat. 60% of the solid weight of your brain is fat. If someone calls you a fathead, say thank you. Fat in your diet does not give you high cholesterol. Sugar in your diet gives you high cholesterol. It's just really clear. In fact, the American Heart Association recently stopped demonizing cholesterol because cholesterol makes all your hormones. If your cholesterol levels are too low, so under 160, so if your total cholesterol is under 160, there's a higher incidence of conduct disorder, higher incidence of suicide, higher incidence of homicide, higher incidence of depression. So think fat and protein in the morning so the blood sugar will be stable throughout the day. All right, I want you to try an elimination diet for 3 to 4 weeks, smaller meals throughout the day, and don't get crazy with their snacks. The saddest meal I can think of is a Happy Meal because it's just loaded with processed foods and sugar. And fruit juice should go away. Whenever you unwrap fruit sugar from its fiber source, think orange juice, it turns toxic in your body and it throws your blood sugar around, which you don't need. So I'm a huge fan of water. I am not a fan at all of fruit juices. So I know so many parents think, well, if I can get my kid to drink orange juice, I'm doing something good for them. But unfortunately, that's not the case. Smaller meals throughout the day, basic supplements, multiple vitamin, fish oil. I think everybody should take those to get the nutrients they need. Sometimes zinc and vitamin D can be really helpful. Omega-3 fatty acids, particularly EPA for ADD. Another practical tip is you want to have really clear goals. So it's really great to ask yourself and ask the kids. We have an exercise called the one-page miracle. It's what do you want in your relationships with your brother, with your sister, with your mom, with your teacher? What do you want? So don't tell them how to be. Ask them how they want to be because they're more likely to be consistent if they know what the goal is. What do you want at school? What's your goal? So that way you don't yell at them to do their homework. You should say, well, what do you want? And then when they're not doing their homework, you can go, well, does this fit your goals? So being very goal-oriented can be very helpful. Another practical tip is love is a drug. If kids are doing, or adults, if they're in a class they love, with a teacher they love, or you're in a job you love, you're going to do so much better than if you picked a career just for the money, because that's what we've seen is that love is a drug. Never forget that ADD is a family disorder. It is just clearly, it runs in families. So in my world, everybody who has it in the family should be assessed and treated. Doesn't mean everybody gets scanned, but we have questionnaires to help people understand, do you have ADD? And If you do, what type might you have? Whenever we evaluate people at Amen Clinics, we're always thinking in 4 circles. We're thinking about biological factors and biological treatments. So that's where you think of medicine, supplements, diet, exercise. Also neurofeedback, where if you know the pattern in someone's brain, you can then actually train it, and neurofeedback is a training mechanism, and it has good science that shows it can be effective. Here at Amen Clinics, we use scan-guided neurofeedback that can be very helpful. So think of all of those as biological treatments. But there also needs to be psychological treatments. So dealing with the psychological issues, especially the negativity, and something I call the ants. Like the little creepy crawly things, the ants, it stands for automatic negative thoughts, the thoughts that come into your mind automatically and ruin your day. And most people don't know that thoughts lie. They lie a lot. And it is often your uninvestigated thoughts that provide the seeds for anxiety and depression. And so we teach everybody this exercise. Whenever you feel sad, mad, nervous, or out of control, just write down what you're thinking. And ask yourself if it's true and if it's helping you or hurting you. And so psychological interventions are just so important. If there's been emotional trauma, which is very common in ADD families, it is critical to deal with that as well. Social interventions, that's where I particularly like parent training, because what I found is individual psychotherapy for ADD kids is not nearly as effective, my experience, as training their parents how to be better parents, how to be, and you want the short course for parenting ADD kids. It's actually the short course for parenting any child. Remember these 2 words, firm and kind. If you can be firm, which means when you say something, mean it, back it up, but always do it with kindness. People who have ADD, because of the low activity in the front part of their brain, they tend to seek conflict, seek stimulation, and seek negativity because it acts as a stimulant. If you have a really positive, loving thought about your wife or about your kid, well, that's really nice. But if you have a hateful thought about them, it's a stimulant. I mean, it really will activate the front part of your brain. The problem is kids and adults who have ADD can get addicted to the negativity, and they have no clue that is actually happening for them. And so parent training, firm, kind, post really clear rules and expectations, and notice what you like a lot more than what you don't like. And then another social intervention is anybody who has ADD in the family should be assessed and treated, because without that, it is too disruptive for people's development over time. And then spiritual interventions is really, you got to ask people why they care, why they're on earth, what's their sense of meaning and purpose. Because when people get passion, their focus gets so much better. In addition, you want to know what you're good at and what you're not good at. Many people with ADD, they have lots of ideas, they're very creative, they're very smart, and they're terrible at organizing themselves. And my life is so much better because I have a wonderfully organized assistant at work. And even though I don't have ADD, it makes my life so much better. If I did have ADD, that becomes so much more important, is to know your weaknesses and surround yourself with people who can help. That's why also the school interventions and accommodations can be so helpful. So the take-home answer is ADD is real. When it is left untreated, there are serious consequences. It's not one thing. There are many different types. There are many ways to heal ADD. My bias is always to start with the least toxic, most effective treatments. Never forget it's a family disorder. And when you treat it, people can truly do amazing things. So with that, I want to make sure we leave time for questions. I hope this was helpful for you.
It was super helpful. Thank you so much, Dr. Amen. Can I just jump right into the question of diet? I think it's something that's of great interest to everyone. And two questions that have been posed by a number of people. Can you recap? You mentioned a number of supplements. I think a lot of people would like to know more about, if you could just recap the names of those supplements and the circumstances in which you would recommend using them.
So, I think the treatments for everybody is to get your diet right. Think of a plate, 70% plant-based foods, 30% high-quality protein, and mixed in there lots of healthy fat, avocados, nuts and seeds, fish. If Tana's just got this wonderful fish stick recipe in her book, Healing ADD Through Food. So you basically want to eliminate all the poisons. I mean, I think of brain health as three things. Brain envy, you have to care about it. Avoid anything that hurts it and do things that help it. And Chloe, my 11-year-old, she and I play this game called Chloe's Game. Is this good for my brain or bad for it? And you really have to figure out what's good and what's bad. We talk about it, but pesticides are bad. And it's associated with ADD. And it's one of the reasons to buy organic food. And I know everybody can't afford organic all the time. There's a website called environmentalworkinggroup.com, which will tell you which foods hold the most pesticides, that you should either buy them organic or you shouldn't eat them. And then which foods are safer. And if they tend to have a thicker skin, like grapefruit, they tend to be safer than if you're eating the skin, like strawberries and blueberries. If they're not organic, you should not eat them. So avoid things that hurt the brain. So pesticides is one. And another supplement I actually didn't talk about that I would give to everyone is a probiotic. And the reason not to eat pesticides is the pesticides kill bugs. That's why they put them on plants. Well, if you ingest them, they kill the bugs in your gut. And the bugs in your gut, we have 100 trillion microorganisms or bacteria and other things in our gut that actually help us digest our food and make neurotransmitters. And so if you're ingesting pesticides, they kill those things. And then you have not only gut problems, you also have brain problems because your gut and your brain are totally connected. So probiotic, I also like fish oil, and the reason I like fish oil is it is anti-inflammatory. Inflammation is associated with many problems in your body and a number of mental illnesses, particularly depression and dementia. So an anti-inflammatory diet, probiotics, fish oil, a multiple vitamin, especially for the zinc, vitamin D, and B vitamins, B6, B12, and folate can be very helpful as stabilizers. And then it really depends on your type. If you need to raise dopamine, I really like green tea and green tea extract. I also like rhodiola and ginseng and L-tyrosine. So those are my go-to supplements to help enhance dopamine. But maybe it's serotonin, worried, rigid, inflexible, things don't go your way, you get upset. And that part of the brain I talked about called the cingulate may be overactive. And then I'll use 5-HTP, saffron, or tryptophan. I like the supplement GABA if I need to calm down anxiety or work on temporal lobe ADD. And so I'm always thinking, okay, here are the basic supplements, multiple vitamin, fish oil, probiotic. I think of that for everybody.
That's helpful.
Think of it with types. And some people, especially with the types, they'll do really well. For example, they might do really well with the serotonin ones, and the dopamine ones not so much, and they need a little bit of the stimulant. But if you do the lifestyle interventions that I talked about, you're probably going to need less medication. So, and the goal should never be no medication. Let me just put it out there as a psychiatrist, because I had this discussion 10,000 times. People go, well, I don't want to take medicine. And I'm like, that's a bad goal. The goal should always be your best functioning. If we can do it without the medicine, great. But, it's sort of like, I think of ADD like people who need glasses. People need glasses, aren't dumb, crazy, or stupid. If we can do eye training exercises and you don't have to wear them, great. But if you need the glasses, it may save your life.
Interesting. Yeah. In terms of finding out one's type of ADHD, I think there's some. I know that the full scan is the best way, but for those who can't do that, I think there are some quizzes on your site that are helpful. Is that right?
Right. If they go to healingaddcourse.com or they get my book, healingadd.com, we have a questionnaire. And a long time ago, I realized not everyone can get a scan. I mean, If you've tried 3 things and it's not working, come get a scan. I mean, people go, oh, the cost. And I always think, well, what's the cost of having an effectively working brain? I mean, that's expensive. The cost of the scan's not expensive when you compare it to. But the first thing is take the questionnaires, read the book. And we have literally thousands of stories of people who got better by doing the simple things we recommend.
That makes huge sense. Could you just explain very briefly, I know it can be a long explanation, but at a simple level, what an elimination diet is? Not everyone seems to have heard of it.
So it's basically you eliminate any potential allergens or toxins from the diet. So the one they did in Europe, the kids could eat lamb, turkey, vegetables, rice, pear juice. That was it. And it was amazing, the response that they got. Just amazing. In Healing ADD, I actually lay out the elimination diet we use here at Amen Clinics and also at Healing ADD course. But basically, you eliminate gluten, corn, soy, dairy, and chocolate to start. Although I don't know if you know, but we actually make our own brain-healthy chocolate, no sugar, no dairy.
Wow.
It tastes awesome. But so, and people go, oh, well, there's nothing I can eat. Well, it's true if the sense is all you eat is crap, then there's no crap you can eat. But there are a ton of things you can eat that actually taste amazing. And when you get rid of the processed fast food, your taste buds will come back. In about 10 days, the cravings go away, and an orange, for example, will explode with flavor. Where, when you're eating a lot of processed foods, it doesn't.
Okay, that makes sense. I want to switch to a topic that is surprisingly high number of questions about this. We have 4 or 5 people who have posted that they've been diagnosed with ADHD or ADD late in life, 60, 66, one person in their 70s, and they're asking, is it too late to treat or to start dealing with ADHD at that age?
Absolutely not. In fact, it's more important. As we age, our brain gets less and less active. ADD can get worse and worse. But my favorite story is a 94-year-old great-grandmother who came to see me. And I'm like, why are you here? And she said, well, you help my great-granddaughter, you help my grandson, you help my son. I want to finish the paper. I've never been able to finish the paper. And we scanned her. She clearly had ADD. And a month later, she came back and, she had the biggest smile on her face. And she said, Dr. Amen, I read my first book.
Wow. That's great. Yeah.
It's never too late.
All right. And at the other end of the spectrum, there's someone on the webinar who's has a strong family history of ADHD and a 3-year-old daughter who is absolutely incapable of stopping moving. Her family's convinced that she has ADHD, but their doctors and pediatricians won't even entertain the thought of treating a child at this age. What's your feeling on kids under age 5 or 6?
They should see child psychiatrists. I mean, they should see people who are really experienced in that. 30% of 3-year-olds look hyperactive. About 5 to 10% of 4-year-olds look hyperactive. So I think unless you're really an expert, the first time you can diagnose it is 4 years old. Children under 3, the prescriptions have, I don't know, quadrupled over the last 20 years. They've really gone crazy. And I'm thinking, well, let's do the natural things first and see what progress. But if you're 3 and you're unable to control yourself, focus, that's already starting to do a negative thing to your self-esteem and to your ability to catch up to your peers. So, I wouldn't do a stimulant right off, but I'd do the other things, and if they didn't work, then I'd do a stimulant.
Okay. Do the natural, the healthy, the food, and avoiding sugars, fruit, and so forth.
The food, the supplements, the exercise. You bet.
Makes sense. How about neurofeedback? People are interested in that's one of the tools in your toolkit. Any comments on neurofeedback, types of neurofeedback? I think people find it somewhat confusing and overwhelming, the number of kinds of neurofeedback programs there are available nowadays.
I'm a fan of it because it's basically a brain training program. I like to do the training based on the type of brain a person has. So we use scan-guided neurofeedback because it's quite an investment in time and energy. And so we do it. We've done it for a long time. We feel like it's very effective. Now, it's more effective when you do it in context of the other things that we talked about. But I think it needs to be directed to what's going on in your brain. If you do, the standard ADD protocol for everybody, it helps some people, but it actually hurts other people.
Okay. Interesting. Lots of concern from people about how to find a good expert. If they can't get to one of your clinics, are there others around the country that follow your protocols? Are there any in Canada? And in general, how does one go about finding a knowledgeable practitioner?
So we actually have 700 affiliates.
Really?
I think many of them are listed on our websites.
That's great news.
They don't do the imaging work, but they use our questionnaires and know how to recommend things like supplements. So if they go to amenclinics.com, that's the easiest way to get to us. Go to amenclinics.com and click on clinics and then professionals. They can find some of our affiliates around the country.
Oh, that's terrific.
Unfortunately, I have got to run because I've got to.
Okay. Dr. Drummond, thank you so much for all that you do and for your time today. It was extremely helpful. And,
thank you so much. It's always my pleasure to be connected with you guys and to help serve your community.
Thanks again.
For more Attitude Podcast and information on living well with attention deficit, visit attitudemag.com. That's ADDITUDEMAG.com.